Doctors of Reddit, what's your thank god they came in for a second opinion moment? Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later he came back. Same symptoms. However, this time he talked about 5 roommates. It felt wrong, and I digged in his story. Tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. This is my favorite story on this post I've read so far. I also have 4 roommates and thought about how they can sometimes be hard to live with for a moment. I now have to go home and make sure they're all real. I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else as I've seen. Of course, those other patients that are the nicest and are profusely apologizing for wasting our time, and of course, those other patients that have a brain tumor show up on their CT scans. Were the tumors pressing on the Canadian cortex? I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility, big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better and wanted to send him to us. Sure, send away. An hour later the gentleman arrives and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. Yet another morbid Monty Python sketch in this thread. We've done all we can with this patient, Dr. Skyskimmer, and he just isn't responding. He has a big hole in his back and pneumonia, which we treated with a course of antibiotics. Sorry, he has what again? A big hole in his back and pneumonia that you treated with antibiotics. I mean, obviously we also gave him IV fluids and put him on a ventilator. But, did you apply a bandage? Respectfully, Dr. Skyskimmer, do not bandage the lungs has been a point of emphasis for some time now. Tell me, have you been keeping up with the literature? Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanimous. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Dermatology patient here, 37 years old, history of blistering sunburn, approximately 30 to 40 over the course of my life, blonde hair, blue eyes. I go to the derm and ask for a full skin exam every damn year. Oh god, where to start? I literally just admitted this lady to ICU. Had been coughing for ages, 60-pound weight loss, smoker for 50 years. Now she can't breathe, and I got a CT 6cm mass, looks very suspicious for lung cancer. And the doctors for 4 years throughout this just gave her vitamin D/E, even though she was losing massive weight and coughing up blood. Another guy who came in looked pale as a ghost. Chief complaint was fatigue. One lab test later found out his hemoglobin was 4, barely on the cusp of survival. Seems like he had iron deficiency anemia for years. Doctor gave him some iron. He got better, but no one looked into why he got it. Number 123 reason in an older guy's colon cancer. He died 4 months later from metastatic colon cancer. Another story, last month was about to take a long trip across the Pacific. 1 hour in on the flight they ask for a doctor. I volunteer myself. I see this lady literally gasping for air, like waving her hands in the air cause she can't breathe. Look through the meds, she's obviously an asthmatic. Listen to her lungs and faint wheezing, no air movement at all. I later grounded that plane. because there was another 16 hours to go and she was on verge of being intubated. Later I get more story from family member. Apparently she wasn't been able to sleep well for past 2 weeks. Doctor just gave her sleeping meds, more and more of it. Told her, flying, no problem. I asked the family, why can't she sleep? Is it because she wakes up in the middle of the night gasping for air? Classic sign of uncontrolled asthma. They're like, yes, how did you know? Sleeping meds prob among worst things she could have gotten. And almost killed a patient by saying she could fly. People who get diagnosed with bronchitis when they have heart failure and literally drowning in fluid. There are doctors who give antibiotics and steroids for everything, especially when they have no idea what's going on. Maybe I'm biased because I work at an academic center, so I see all the cases who get referred in because they are too sick or no one can figure out, but at least a few times a week I'm like, wow, this person could have been saved or not end up this way if someone cared enough earlier on. I'm going to say this as a doctor. It's honestly scary every day how many patients I see are completely mismanaged. Some doctors in urgent care see like 45 patients in a day. How is that possible to be thorough? Like if only patients knew what the doctors missed or whatnot. Half the time I really think it's like going to a bad auto shop and not realizing they are just making half the shit up. Same thing happens in medicine, and except people's lives suffer because of it. This makes me so angry because I had a stomach ulcer for over a year that 3 separate doctors just kept treating with PPIs. None of them did a endoscopy on me. It took the 4th doctor doing a second endoscopy to figure out that I had stomach cancer at 31. They even knew I had a family history of gastric cancer. It's stage 4 now because these idiots never bothered to actually treat me. Luckily it hasn't spread to any other organs and my oncologist is amazing. And the treatment is working, but I can't help but be so livid that this all could have been treated over 2 years ago at this point and I probably would have had far better odds. When I hear stories like this, I always wonder if you got in touch with the earlier doctors who just waved you off and tell them, oh hey, just a heads up, it was stage 4 stomach cancer. Cause I feel like that's what I'd do, if for no other reason than maybe they slow down and don't do it to someone else. I'm a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. This is an important distinction because often if the doctor forwards your file to a different doctor they'll flavor it with their interpretation. As a mental health patient this is one of the most infuriating things imaginable. Once you're diagnosed that's it. No one will ever look at the evidence again. They'll just assume the previous person got it right and then add whatever you say to that. But the original diagnosis was about 10 doctors ago. So basically I've gone to the GP, told them what's wrong, had them write it down, and then another GP has come along and read what they wrote and reinterpreted it, and then another does the same, then another. I no longer have any confidence that my diagnosis is even remotely correct because the doctors have basically been playing rumors with my file for a decade. Doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway, just because we might as well while she was there. She was a 50-year-old woman. Fairly normal exam. Perfect vision. Retinas showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it, and I asked her if she banged her head or anything weird, and she said no, but suddenly reveals this crazy history of an old meningioma, a type of tumorous brain growth she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important, but we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward, patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. I'm not a doctor, but I'm glad my parents took me in for a second opinion when I was complaining about a bad headache when I was 15 years old. I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus and that I should just rest and take meds. I went home, laid down and took some Advil and carried on with my night. Around 1 AM, I was screaming on the floor. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis. Had a patient come in for therapy after his PCN yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. To be fair, it was all in his head and possibly spine. Took me a few years to finally get my MRI and multiple sclerosis diagnosis. It is a to get taken seriously for, so thank you for that.